I'm Libby. I'm Jordan.
And I'm Mallory.
And we're Xavier nursing students. We're on our senior year, and we're just going to be talking to you about medical encounters in the classroom.
So the first topic we're going to talk about tonight is HIPAA, and it was passed in 1996. And basically, it's a federal law that protects personal health information for individuals. So it gives patients the right to protect their private health information. So that includes their name, address, and any information, relating to their disorder or their illness. So what do you need to know about that is that it's a privilege to receive health information. So it's only shared on a need-to-know basis. Okay, so our next topic is infection. An infection is the state produced by the invasion of a host by an infectious agent. So some general signs and symptoms of infection, so fever, pain, pus, redness, swelling, heat at the site, and foul odor or discharge. So it's important to be aware of these signs and symptoms because in order to prevent the spread of infection, you'll want to take care of this right away. So if you see these, surrounding a wound, it's very important that you contact this school nurse. So the goal is it's to ensure the protection of those who might be vulnerable or more susceptible to infection. So that includes those who are most immunocompromised. So the basic principle of infection is proper hand hygiene. The standard precautions and universal precautions. So what is it? It's basically your personal protective equipment. So that's like gloves, gowns, eyewear, and then decontamination, and then proper waste disposal. So it's important in order to protect yourself, protect the patient or the student, and then prevent further spread of infection. So you need to use it when you're in contact with blood, bodily fluids, and soiled materials. So, and then another important topic to keep in mind is that all blood and body fluids are potentially infectious, so it's very important to use gloves anytime you're in contact with that. So now we're going to practice our gloves, donning gloves the proper way. And it's important that you want to wash your hands before you put on gloves. So if you could all pick up your gloves. And then you'll want to handle them least amount of possible. You don't want to touch that. You want to keep it as clean as possible. So we're going to put them on. So for me, the easiest way to remove gloves is to remove my non-dominant hand first. So I would pinch the outer surface and I would take it off like that and ball it up in your hand. And then you would want to grab underneath and you wouldn't want to touch the outer surface because you don't want to contaminate your hand. And then you just pull it through. So, very good. Okay. So then we go into hand washing. I just want to emphasize on how important it is to properly wash your hands because it is the number one, thing to control infection. So it's very important. So it's important for you to be able to recognize common first aid emergencies, so such as burns, cuts, head and neck injuries. And it's also important to implement safety within the classroom. So you'll want to teach and practice safety techniques in order to avoid accidents. And then also there's a method called teach back, which you'll have your students, teach back what you've just taught them concerning safety. So an example would be how to properly, carry your scissors or properly use scissors within the classroom when you're doing projects. Okay, so CPR. Is there anybody certified in CPR? Okay, so a good amount. It's very important. So if you want to get certified, there's places like Red Cross and the American Heart Association that are great places to get certified. So CPR is the artificially perform the work of the heart if it stops beating. So providing the breath and pushing on the heart directs oxygenated blood from the heart to the brain. So this pumping action keeps the brain alive. So CPR is, as easy as like saving a life. So it's important not only in your guys' profession, working with special needs children, but also as a lay responder, within the community. So anaphylaxis is a life-threatening allergic reaction. It can cause shock, a sudden drop in blood pressure, and trouble breathing. And it can occur within minutes after exposure to an allergen or several hours later. So here are some symptoms of anaphylaxis. So it includes hives, swelling of the throat, lips, tongue, or around the eyes, and then increased heart rate, a sudden feeling of weakness, loss of consciousness. So what you want to do is first stay calm. Don't freak out. Because if you show, that you're, feeling anxiety or, you're worried, it'll only make it worse for the child. So you'll want to immediately call 911. And if the child has an EpiPen, know where they keep it, right off the bat. So this is what an EpiPen is. And it's nice because most of them have directions for use. So if you're not used to using one, it's simple directions. I can pass this around in a few minutes. And then you'll want to have the person lie on his back or her back. And then in order to prevent aspiration if they start choking on blood or fluid or anything that comes out. And then if there are no signs of breathing or coughing or movement, you'll want to begin CPR. And even if the treatment, saves the person's life, and they're better, you'll want to call, and make sure they get to the hospital. Asthma is the most chronic condition among children. It's a condition in where the airway narrows and swells and produces extra mucus. So this makes breathing difficult, and most commonly it triggers coughing, wheezing, and shortness of breath. It's not curable, but symptoms are treatable. The prevalence of asthma is growing every year, and it's just important to know what it is since you'll be working with children every day, within your career. And then these are some symptoms of an asthma attack. So it's like repeated coughing, wheezing, if they complain that their chest feels tight or it hurts, fast breathing, runny nose, and if it looks like it's having a hard time for them to breathe. You have to be able to recognize these symptoms in order for you to help the child and maybe send them to the nurse's office or get the nurse involved, the school nurse involved. What do you do during an asthma attack? So again, you'll want to stay calm, which is what you want to do with any kind of crisis, and review the doctor's instructions. So usually they'll give albuterol, which is a fast-acting inhaler, and offer the child frequent, drinks of water, juice of whichever they choose. That will help the fluids, moisten loose, so they'll be able to cough it up. And if they're coughing, you'll want them to encourage them to cough and get it all out. And then have them, rest afterwards. So in 2012, there was reported 29.1 million Americans, or 9.3% of the population, has diabetes. So the incidence, the number of new cases of diabetes in 2012 was 1.7 million. And some common symptoms include, we like to call it the 3 Ps, so increased urination, which is polyuria, increased thirst, polydipsia, and then increased hunger, which is polyphagia. That's what we call it in the nursing. And these are some methods of diabetic care. So the glucometer is the green thing, and that's what checks your blood sugar. There's different ways to control it. There's insulin shots, which is the shot, and then there's also insulin pump. So there's two different types of diabetes. Type 1 is usually most diagnosed in children and adolescents, and only 5% of the diabetic population has this type of diabetes. And this is where the body does not produce any insulin at all. And insulin is your body's mechanism of way of like controlling your blood sugar. And so type 2 is where the body does not use insulin properly. So it's called insulin resistant. And for type 1, the first line, like the treatment is usually insulin therapy. So you would give them the shots of insulin or the insulin pump. And then type 2 diabetes, they usually like to use diet and exercise, proper diet and nutrition. So some diabetic emergencies. So hypoglycemia is when your blood sugar is too low. So some symptoms would be shaking, sweating, hunger, feelings of weakness, dizziness or headache, irritability, fast heartbeat, anxiousness, and blurry vision. And then hyperglycemia is when your blood sugar is too high. So that would be frequent urination and, frequent thirst. So if, a student is experiencing a hypoglycemic reaction, which it must be treated immediately, because if you let it go on for, if it gets too low, the person could go unconscious and possibly die. So it's very scary thing. So what you want to do is, give them some kind of sugar. So we have some Life Saves to show you how a lifesaver can save a life with a hypoglycemic reaction. And then you will never want to leave the child unattended because they can lose consciousness. Just like when you send them to the nurse's office, make sure you go with them just in case they pass out in the hallway and no one knows what happens to them. So type 2 diabetes can be prevented with proper, physical activity, proper nutrition. So you want to make sure you encourage or teach your students to get proper physical activity, plenty of fiber, whole grains, lose any extra weight, and skip bad diets. So some teacher considerations for diabetics. You'll never want to deny a child's request for a drink of water or blood sugar test. And then kids who inject insulin before lunch might need a little extra time, so you might want to play that into consideration and accommodate them. And allow and don't deny a child with diabetes to eat snacks. So if it's, the physician, prescribes that, you'll want to consider that and comply.
Child abuse and neglect. This is a big thing because you guys are seeing these kids every single day, so you're going to be able to pick up on things if they're happening. So signs of physical abuse, they're going to have unexplained bruises and welts, and they're going to be in areas, probably the neck, the legs, the buttocks, and there could be unexplained burns, there could be rope burns, and the burns could be infected. And also, their behavior is going to be a big thing. They're going to have extremes. They could act out, or they could just be really shy. It just depends on what their norm is. Just if they're acting extremely different than what they are, that's a behavioral indication. And they could have inappropriate or excessive fear of a parent or a caretaker. They could become antisocial, and it could be inconsistent if the student's able to communicate and talk to you. If you ask them about how they got the bruise, they would say one thing one day and they could change their story the other day. And it could actually cause them to become shy as well. And sexual abuse is a big thing too. Physical indicators of sexual abuse would be stained, torn, or bloody underclothes. The student could be having frequent, unexplained sore throats or yeast infections or UTIs. And another thing with that too is if your student is incontinent and they're in diapers, or if you have to change their clothes, another thing to note if you suspect sexual abuse is if you notice any unusual discharge or any unusual visual sores or a foul odor coming from that area, then that would be a warning sign that they could maybe be being sexually abused. And they're going to complain. They could have complaints about pain in the genital area. There could be visible bruises in that area, and there could also be some bleeding. That just depends. They could have disturbed sleep patterns. They would have an interest in sexual matters, and there could also be a decline in their performance at school, and it could be difficult to walk or sit. For emotional abuse, this is just a general. They could have eating disorders or speech disorders or further developmental delays. Their weight or height could vary, and they could have nervous disorders, or if you can tell that if you're like talking to them, maybe they won't make eye contact or they'll feel timid. Their behaviors, they could have age-inappropriate behaviors or also behavioral extremes. And then neglect. So neglect is when they're not getting they could not be getting proper food or water, or they could just be not being bathed every day or just not being paid attention to like they should. They're going to have poor hygiene. Their clothing isn't going to be suitable, like they could be wearing summer clothes in the winter. You can just tell by the way they're dressed or if their clothes are clean. They're going to have lack of immunizations. So if you see that, the school nurse would see if they're getting their proper immunizations, and you could follow up with that. And their height and weight could be below their age level. And if they're not attending school like normal, or they're usually at school and they start to not show up, then that could be a sign. And they could always be hungry and always be tired. And another big thing is with eating, they could, you could notice an increase in hunger, or they're begging, or they're asking for food more often. And in some kids, they actually start to assume more adult responsibilities. Okay, and so if you suspect that child abuse is happening, if you're in Cincinnati, I encourage you 241 Kids. You can be anonymous, but if you dial 241 Kids, you can report child abuse, and this is a huge thing. This was actually started by a person in Cincinnati. And if a child reaches out to you, if they're able to communicate and they do say that they are being any kind of abused, just remain calm, and the do's and don'ts, just believe the child, listen to them, show concern, reassure them that you support them, and report it. You can be anonymous, but I really do encourage you to report it because this is really important. And don't overreact. Let the child talk. Don't press them for information. Just let it out, and don't just follow HIPAA and their privacy, and don't tell other people. Just report it and let the child know that they can trust you, and don't obviously go to the person that is doing the abusing. On to obesity. So up to 1 in 5 kids in the U.S. is overweight or obese, and these kids that are obese and during childhood are more prone to stress and sadness and low self-esteem during adulthood. And weight problems can run in the family, but not all with a family history will be obese or overweight. And I found some statistics about kids with disabilities. 50.8% of children receiving special education services were either overweight or obese, and this was between 1999 and 2002. And 80.6% of children with functional limitations on physical activity were either overweight or obese. And so that just goes to show that, kids that are in wheelchairs, they're not getting the exercise and the physical activity that other kids would be getting, but we'll get to this. There are ways to encourage activity. So to prevent for obesity, the biggest thing would be prevention. So make sure that if a kid isn't obese, they are getting exercise or they are doing some sort of movement. And I know at schools they're starting to do BMI screenings, so they're looking at the kids' BMIs earlier to seeing if they're on the track to being obese or overweight. And a big thing is encouraging parents and people that are around the kids to be good role models about what they're eating, and they should be eating healthy foods, fruits and vegetables. Encourage physical activity if possible. There are ways that you can, with kids in wheelchairs, a thing you could do is if they're at recess or if there's free time, turn on some music and have them move their arms and dance. That's just moving, and that's getting them like working, and also you can physically help the kids move in their wheelchairs, or like sit them up or lay them down certain ways, just get them moving every once in a while. And when if you're doing nutrition lessons, just make sure you're exposing healthy foods. And it's good to do a class-wide motivational system so everyone's on the same page, like everyone's encouraging people to eat healthier. And if a student is overweight or obese, and if they can understand that and they want to fix it, just help them set measurable and realistic goals about eating healthy. This is a Harvard healthy eating pyramid. This is from Harvard's website. And on the bottom, they have daily exercise and weight control, which would be prevention. Just make sure that they're getting the exercise that they need. And then you have your healthy fats and your whole grains. And then you have your protein, your poultry, your healthy fats, and then dairy. And then at the top, you have eat sparingly red meat, sugar, salty foods, and stuff like that. And then when you're teaching about nutrition, just make sure that it would be helpful for you guys to know how to read and interpret a food label so you can help them. And you can explain about calories in food and how to burn calories through exercise. And like I said, if they're in a wheelchair, there's other ways that you can have them do there's therapy they can do, or just any way to get them kind of moving around. And teach about the healthy foods, fruits and vegetables instead of chips and candy, or water and 2% like lower fat milk instead of pop.